Bismillahirrahmanirrahim. Assalamualaikum and good morning, everyone. I welcome you to the new blog. Okay. Today I'm going to talk about the blood supply of the heart. Okay, the lecture of mine, I'm going to talk about the coronary artery. There are two coronary arteries, the right and the left coronary artery, and about some notes on coronary sinus and clinical relevance. Okay, as I mentioned, we have two coronary arteries. Okay, this is the coronary arteries. Okay, coronary arteries are the vessels that supplying the myocardial muscles and tissue so that our heart can pump blood throughout the body. So coronary arteries are one of the most important structure in our body. Okay, we have two coronary arteries, the right coronary artery and the left coronary artery. Okay, let's talk about the right coronary artery first. So the right coronary artery. Okay, this is the course of the coronary artery. So you have to know this. Okay, I will explain or show you in step by step. Okay, one by one. Okay, firstly, okay, let's look at this image here. You can see it arises from the interior aortic sinus. Aortic sinus is located here. Okay, there are it has three sinuses. Okay, the right coronary artery arises from the interior part of the aortic sinus. It's the anterior aortic sinus. And it passes between the right auricle and the infundibulum of the right ventricle. And it passes running downwards in the AV groove. And it passes backward. Okay. Okay, let's go one by one. Okay, this is actually the same thing. Okay, remember I told you this is the aortic vessel, aortic valve. Okay, it has three sinuses here. Okay, this is the aortic vessel. Okay, it has three sinuses. Okay. Okay, one is anterior and another two posterior. Okay, for the anterior coronary artery, it arises from the anterior aortic sinus, particularly this one. Okay. After that, coming out from the anterior aortic sinus, okay, it passes between the right auricle. The auricle is part of the right atrium and the infundibulum of the right ventricle. Okay, in between these two. And after that, it's running downwards in the AV groove, atrioventricular groove, until it reaches its inferior border. Okay, and before it runs posteriorly. It's run posteriorly. Okay, so easy. Okay, first it arises from the right aortic sinus. Okay, after imaging from the right aortic sinus, it passes between the right auricle or the right atrium and the right infundibulum of the right ventricle. It passes downward, okay, in the AV groove, atrioventricular groove, until it reaches its inferior border before it passes posteriorly to supply the posterior part of the heart. Okay, these are all the branches of the right coronary artery. the conus branch, there is a nodal branch, the right marginal artery, the posterior interventricular branch. Okay, this picture is actually it posterior part of the heart. Again, you have and the right posterior lateral branch and the AV nodal branch. Okay, the conus artery or the conus branch. Okay, the conus branch, they supply the conus arteriosus or infundibulum of the right ventricle. They supply somewhere in here. Okay. And then the SA nodal artery is at the beginning of the artery. It supplies the SA node. And the right marginal artery, this one, the right marginal artery with the inferior border of the heart, so it supplies the right ventricle up until the apex of the heart. The posterior interventricular branch of artery, also known as posterior descending artery, where the posterior interventricular groove descend in the groove to the apex. So it's actually supplying the interventricular septum or posterior part of the heart. And AV nodal artery near the termination of the artery, it supplies the AV node. And lastly, there is actually left ventricular branch or right posterior lateral branches, small branches that anastomose with the termination of the circumflex branch of the left coronary artery. Okay, typically the RCA, the right coronary artery, supply the right atrium, obviously, most of the right ventricle, part of the left ventricle, okay, especially the diaphragmatic surface down here, and part of the IV septum, IV septum's interventricular septum, usually the posterior third of the IV septum, and the SA nodes. In approximately 60% of people, SA nodes is supplied. The branch and SA branch is actually arising from the right coronary artery, and the rest is actually arising from the left coronary artery. Okay, and the AV nodes in approximately 80% of people. No, don't worry about the percentage because I'm going to talk about the variation after this. All right, okay. We already learned about the right coronary artery. Okay, repeat again. Okay, it arises from the anterior aortic sinus. Okay, passing down, emerge from the anterior aortic sinus. It passes between the auricle of the right atrium and infundibulum of the right ventricle, and then it passing downwards, the AV groove, atrioventricular groove, until it reaches the inferior border before it turns posteriorly. Okay. Okay, how many branches do we have just now? Number one is the conus branch, and then SA nodal, and then the marginal, right marginal. Okay, and then posterior interventricular. Okay, and then AV nodal, and the left, which actually anastomosing with the left circumflex artery. Okay, that's all about the right coronary artery. Now we move on to the left coronary artery. This is the left coronary artery. Okay, the left coronary artery, the course is actually simpler than the right. Okay, number one, it arises from the left posterior aortic sinus behind the pulmonary trunk. And then after that, the vessel emerges between the left auricle. This is the left auricle of the left atrium, and the infundibulum of the right ventricle. And it's divided into two terminal branches. Okay, two terminal branches of the left coronary artery. Okay. Okay, that is actually the same picture what I showed in previous slide. I'm sorry for this. Okay, it arises from the left posterior aortic sinus. Please, okay, it must be left posterior aortic sinus because we have two, left and right posterior. So it arises from the left posterior aortic sinus. Okay, where is this located? It's behind the pulmonary trunk. This is the pulmonary trunk. So the left coronary arises or emerge from the aortic sinus, left posterior descends behind the pulmonary trunk. Okay, the vessel emerges between the left auricle, and the ventricle, infundibulum of the right ventricle. Okay, yeah, and then it's divided into two terminal branches. Okay, which are the left circumflex artery and the left anterior descending artery or anterior interventricular artery. Okay, this left LAD is commonly used in clinical. But in anatomy, you commonly use anterior interventricular artery, but they are two the same artery. LAD and anterior interventricular artery. Okay, these are the branches of the left coronary artery. Circumflex branch has actually not really branches, it's the terminal branches. Okay, circumflex branch and anterior interventricular branch, and also the left marginal. The left marginal, this is actually the branch of the circumflex, left circumflex artery. Okay, circumflex branch. Let's go to the circumflex branch first. It is the continuation of the parent trunk. So remember, this is the left coronary artery parent trunk. It continues as the circumflex branch. Let's follow the AV groove. Follow the AV groove around the left border of the heart and runs along the posterior part of the groove and terminates by anastomosing with the end of the right coronary artery. And the left marginal branch, this one. The marginal branch arises from the circumflex branch. It follows the left border of the heart. LAD, left anterior descending or anterior interventricular artery descends in the anterior interventricular groove to apex, where it turns posterior and anastomoses with the posterior interventricular artery. Typically, the left coronary artery supplies the left atrium, most of the left ventricle, some part of the right ventricle, most of the IV septum, interventricular septum. Usually it's anterior 2/3, including the AV bundle of the conducting system of the heart, which located in the IV septum, and the SA nodes in 40% of people. Okay, this is actually the diagram showing the area of supply of each of the major coronary artery. Okay, left anterior descending is here. Okay, is supplying the right and the left ventricle, and also the interventricular septum. And the left marginal artery supply the left ventricle. The right coronary artery supply the right atrium, the right ventricle. The right marginal artery supply the right ventricle up until the apex. And left circumflex artery supplies the left atrium and the left ventricle. Okay, actually just want to repeat again. Okay, the left coronary artery, it rises from the left posterior aortic sinus, and it emerges coming out from the aortic sinus, posterior to the pulmonary trunk. Okay, and passes in between the left auricle and the right infundibulum of the right ventricle before it terminates into two branches, which are the left circumflex artery and also the left anterior descending arteriality. Okay, and after that, it's turned posteriorly in anastomosing with the end of the right coronary artery at the margin of the heart, at the margin of the left border of the heart. It gives off branch of the left marginal artery. Okay, this is variation in coronary artery. Yeah, this variation is variation in term of posterior interventricular artery. So PIVA, posterior interventricular artery variation in coronary artery. It will determine whether the right is the heart is the right dominant or the left dominant heart. If the posterior interventricular artery arises from the right coronary artery, it is right dominant, and it's happened in like 67% of human. And where else the left dominant heart, the PIVA is actually arises from the circumflex artery, which is the continuation of the left coronary artery. It's about 15%. All right. And what about the waist? Because this one is 15% and this is 67%. Actually, there is many more variation, okay, in coronary artery. Okay, like in these cases, myocardium. Okay, this is the heart is all supplied by the left coronary artery. Okay, this. Like in this case, most of them are supplied by the right coronary artery. So there are many variations in coronary artery. But PIVA is one of the commonest variations. And anastomosis of the coronary artery, anastomosis exists at the arteriolar level. Okay, they can be found at cardiac, at all the cardiac levels. Okay, the superficial or epicardium, subepicardium, the myocardium, and the cardium. This is at the level of the anastomosis. Right. Okay, anastomosis of the coronary artery can be found in these four areas. Okay, number one is between the termination of the right and the left coronary arteries in the atrioventricular groove, specifically at the crux area. So number two is between the interventricular, it's either anterior or posterior interventricular branches, and at the conus branch, and also the apex. Okay, what is the importance of having anastomosis? For a slow progressing occlusion of the coronary artery, there will be time for healthy arterioles to open up. So this will provide a good prognosis for the patient that have coronary artery occlusion. Okay, another picture showing where are all the anastomosis, the conus branch, interventricular branches, anterior and posterior, the apex, and between the termination of the coronary arteries in the cortex area. Okay, now we go to the veins of the heart. Veins is because we have coronary artery, obviously we have the structure that drain the blood from the coronary artery, which is the coronary sinus. That is to be utilized. Okay, this is coronary sinus. It's located posterior, the posterior part of the surface of the heart. Okay, coronary sinus. Okay, it is a white vessel, lies in the posterior atrioventricular groove, covered by a thin layer of myocardium, opens at its right end. Okay, the open casing open at its right end into the posterior wall of the right atrium. Okay, this is the right atrium. Okay, this is where the opening of the coronary sinus. Okay, specifically located at the left side of the opening of the inferior vena cava. Okay, what are all the tributaries of the coronary sinus? This means the vessel that drain into the coronary sinus are all the six, okay? Great cardiac veins, middle cardiac and small cardiac veins, posterior vein of the left ventricle, oblique vein of the left atrium, anterior cardiac vein. Wow, where are all these vessels? Okay, we have great cardiac vein, and then we have middle cardiac vein, and also small cardiac veins. And we have posterior veins of the left ventricle and also oblique vein of the left atrium. Okay. And the anterior cardiac vein, anterior cardiac veins. Okay, one of the structure that drain deoxygenated blood is in the myocardium is known as venae cordis minimi. Venae cordis minimi. There are very small veins in the walls of the cardiac chambers that drain venous blood directly into each of the respective chambers. So the muscle to form chamber of the heart. And they're most frequently found in the right atrium. But they can be present in all of the four cardiac chambers. Okay, some clinical notes. Okay, it's about the coronary artery disease, which I'll be talking about the myocardial infarction, coronary arteriosclerosis, and what is in general pictures and coronary bypass surgery. Coronary artery disease is one of the leading causes of death. It has many causes, all of which result in reduced blood supply to the vital cardiac tissue. So what is myocardial infarction? Let's go to the next slide. The myocardial infarction is sudden occlusion of major artery by embolics. Okay, the region of myocardium supplied by the occluded vessel become infarcted. And then it undergoes necrosis. These are the three most common signs for coronary artery occlusion. Number one is anterior interventricular or LID, or left anterior descending artery, a branch of left coronary artery. And number two is right coronary artery. And number three is circumflex branch of the left coronary artery. Okay, I repeat it. Number one is LID, number two is RCA, and number three is circumflex branch. And number four is left coronary artery. So interventricular, and this one is interventricular branch of the right coronary arteries. Okay, the site number 1, 2, and 3 account for at least 80% or 85% of occlusion. So majority block dekat sini, 2. And what is coronary arteriosclerosis? We will learn this in pathology. It is characterized by lipid deposition. Okay, this is known coronary artery. It initially begin with the fatty streak formation and the tunica and tumor, and eventually develop the narrow or the lumen. Okay. As coronary arteriosclerosis progresses, the collateral channels connecting one coronary artery with the other expand. Okay, this is the anastomosis. Okay, which may initially permit adequate perfusion of the heart during relative inactivity. Despite this compensatory mechanism, the myocardium may not receive enough oxygen when the heart needs to perform increased amounts of work. Strenuous exercise, for example, increases the heart activity and its need for oxygen, and thus insufficiency of blood supply to the heart may result in myocardial infarction. Okay. Angina pectoris is pain that originates in the heart. Okay. Individuals with angina commonly describe a transient, moderately severe constricted pain with tightness in the thorax deep to the sternum. The pain is the result of ischemia of the myocardium. It falls short of including the cell and it causes the defining infarction. Very short duration. Most often, angina results from narrow coronary arteries, not totally occluded coronary artery. Okay. Angina pain is relieved by a period of rest. Okay. 1 to 2 minutes of rest, often adequate, very minimal ischemia, and in a severe condition, and with known case of coronary occlusion, the doctor will supply with sublingual nitroglycerin or GTN, and when the patient experience angina pain, they will put the GTN sublingually. This will cause dilation of the coronary arteries. Coronary bypass surgery is in the patient in the case of total occlusion of coronary artery, total obstruction of the coronary artery. The patient might undergo a coronary bypass graft operation. A segment of an artery or veins is connected to ascending aorta, the proximal part of the coronary artery, and then to the coronary artery distal to the stenosis. The great saphenous vein is commonly harvested for coronary bypass surgery because it has diameter equal to or greater than that of coronary arteries. Number two, it can be easily dissected from the lower limb for a relatively lengthy portion with a minimum occurrence of valves and plenty. Okay. Okay, I haven't shown this. Okay.
A coronary artery bypass graft, or CABG, is performed to improve circulation to the heart muscle in people with severe coronary artery disease. In this procedure, a healthy artery or vein from another part of the body is connected or grafted to the blocked coronary artery. The grafted artery or vein bypasses the blocked portion of the coronary artery, carrying oxygen-rich blood to the heart muscle. One or more coronary arteries may be bypassed during a single operation. Before the surgery, an intravenous line will be started, and you may be given a medication to help you relax. CABG procedures are done under general anesthesia, which will put you to sleep for the duration of the operation. A breathing tube will be inserted through your mouth and into your throat to help you breathe. A catheter will be placed in your bladder to drain your urine. Coronary artery bypass surgery generally takes 3 to 6 hours. During a conventional bypass surgery, your surgeon begins by making an incision in the skin over your breastbone or sternum. He or she will then cut the sternum and move your rib cage in order to get to your heart. Throughout the procedure, your circulatory system will be connected to a cardiopulmonary bypass pump or heart-lung machine. This machine temporarily performs the functions of your heart and lungs during the surgery, allowing your heart to be stopped while the surgeon sews the grafts into place. One of two blood vessels is typically used for the grafts: the internal thoracic artery in the chest or the saphenous vein in the leg. For the internal thoracic artery graft, your surgeon will leave the upper end attached to the subclavian artery and divert the lower end from your chest wall to your coronary artery just beyond the blockage. Your surgeon will then sew the graft into place. For the saphenous vein graft, your surgeon will suture one end to the aorta and the other end to the narrowed artery just beyond the blockage. With the graft securely in place, your surgeon will use electrical signals to restore the heartbeat and attach a temporary pacemaker to the heart. Once your heart is again beating normally, the heart-lung machine will be disconnected. Your surgeon will wire the breastbone back together and suture the skin incision closed. A temporary drainage tube will be placed through the skin beneath the incision. 2 other types of CABG procedures have recently been developed: off-pump and minimally invasive bypass surgery. Off-pump CABG is also called beating heart bypass grafting because the heart isn't stopped and a heart-lung machine isn't used. Instead, a mechanical device is used to steady the part of the heart where grafting is being done. Surgeons perform minimally invasive bypass procedures using specially designed instruments inserted through small incisions or ports in the chest. These procedures sometimes require a heart-lung machine. After surgery, you will be taken to the intensive care unit. The activity of your heart will be carefully monitored. If necessary, the pacing wires will be used to temporarily control your heart rate. The chest tube will remain in place to drain excess blood and air from the chest cavity. Once you can breathe on your own, your breathing tube will be removed and replaced with an oxygen mask. The bladder catheter will remain in place. As you recover over the next 3 to 4 days, all of these devices will be gradually removed.
Okay, I think that's all. Thank you for your attention. Wish you all the best.